for dinner. Let's wash your hands.
No.
Mr. Stockler.
No.
Hi, Mr. Stockler. Would you like to have some dinner with your friends? How about letting Sally get your hands washed up? Friends will be here in just a minute, okay? Residents with dementia face special challenges, and so do their caregivers. You may recognize some of their common problems with interacting and communicating. But did you know that residents with dementia are often more likely to become malnourished or dehydrated than other residents? There are many reasons behind this fact, some involving their disease and others influenced by your care. Since you work closely with residents, you know firsthand about their care needs and their reactions to that care. Maybe you noticed that Mr. Stockler calmed down and smiled when we suggested that he get ready for dinner because he'll be seeing his friends. As a younger man, he was quite social and had many friends. A familiar routine can now help to calm him. The same may be true with Mrs. Morse. Hi, Mrs. Morse. She is ready for dinner because she just finished putting out the silverware, a task she did countless times as a mother. Again, this is a familiar routine that may still have some meaning for her, even as her memory declines from her dementia. By calling on residents' memories, by helping them to connect with roles they used to play, you can help them to be ready to engage in activities that you or they find desirable. By supporting this familiarity, you can also help them feel content in what they do. In many ways, you can be challenged by behavior and memory loss related to dementia. Despite these issues, residents still need to eat, and you need to help them do so. Clearly, one of the special challenges you face is to make sure residents with dementia eat well, drink enough, and achieve their nutritional goals. You can help by understanding their capabilities and their limitations. As caregivers, use your special knowledge of each resident to help provide important care and good nutrition. If you've seen the previous program in this series, you have a basic understanding of the declines associated with dementia, what residents experience as this disease progresses. You also see how dementia can affect your caregiving. This general understanding is a backdrop to what we'll explain in this program. In this program, we'll focus on prevention and early treatment of nutritional and fluid deficiencies, how dementia changes residents' ability to nourish themselves, and how you can help residents get the nutrition and hydration or fluids that they need. We'll describe changes related to dementia, care needs, body changes that affect eating, and the specific nutrition and eating problems dementia can cause. Then we'll show you some simple things you can do to help residents eat and drink well to meet their nutrition and hydration needs. Using what you know about each resident today and in their lives prior to coming to your facility, and using program schedules, you can create routines that are familiar. Many forms of dementia cause loss of brain function and damage to brain cells. Residents suffering from dementia may lose short-term, sometimes referred to as primary, working, or active memory. This part of the brain holds small amounts of information for about 20 seconds. Put yourself in their shoes for a moment. Imagine that you forgot the last 3 years of your life. Imagine not being able to remember what you did or said 20 seconds ago. These residents can't process new information, so they won't even know that they are disabled and living in your facility. It's easy to understand their confusion, their fear, and even the hostility related to this confusion and frustration. Besides the decline in memory, many residents with dementia face losing their abilities to make plans, to make good judgments, to do complex tasks, to understand what they see, and to speak or understand language. They suddenly become more dependent on others, again, reacting with both sadness and frustration. When it comes to diet, what residents eat and drink, we need to be aware of those residents with dementia. Because they lose short-term memory, some may forget to eat or drink, or forget when they last ate or drank. They may not recognize what it feels like to be hungry or thirsty, and they may have trouble using a fork or spoon. Eventually, eating and even the food itself can become foreign, confusing, even frightening. Again, consider the emotional impact on your residents. When they don't understand or can't remember what they have taken in, they may be less inclined to eat or drink and want to skip meals or eating to avoid the frustration they are feeling. Eating and drinking are both important social activities, but nutrition is also crucial to our survival. People with dementia often need more energy. This can be due to their continuous wandering, fighting off infections, and having surgical wounds or pressure ulcers that need to heal, all of which use up more calories. Poor oral hygiene will have an impact on both hydration and nutritional status. Be especially aware that psychiatric illnesses, especially depression associated with dementia, can reduce appetite and cause weight loss. Other symptoms of depression in dementia residents include them expressing feelings of hopelessness, worthlessness, and helplessness. Many medications can cause poor appetite and nausea. Be especially aware that many of the medications used to treat Alzheimer's disease can cause these symptoms. All right. We know that food and fluids are necessary, but several circumstances can inhibit residents with dementia from getting what they need. By helping recognize signs of poor nutrition and providing early intervention, you can help to avoid invasive treatments such as nasogastric and gastrostomy tube feedings or intravenous hydration. You can help recognize poor nutritional status. Look for residents that consistently refuse to eat 50% or more of 2 meals per day. A recent weight loss. A resident that weighs less than 80% of their desirable body weight. Residents that are approaching 5% weight loss over 3 months or 10% over 6 months. The presence of certain blood chemistry changes may also indicate poor nutritional status. Poor hydration should be suspected in the presence of decreased skin turgor, dry mucous membranes, decreased urinary output, a change in bowel movements, or mental confusion. Changes in vital signs such as rapid heart rate or orthostatic changes in blood pressure and abnormal lab values such as an increase in BUN and an increase in BUN to creatinine ratio of more than 15:1, or abnormal serum sodium may also be indicators of dehydration. Physical changes associated with aging and with dementia can also affect our ability to eat and drink. Many residents with dementia suffer a diminishing sense of smell. This affects the way food tastes and the enjoyment of it. Some residents may also experience a loss of the thirst mechanism, a condition that should appear on a resident's chart. When we taste, we also use our sense of smell. Recall eating when your nose has been stopped up? If you can't smell, things don't taste right. Eventually, many residents with dementia also lose control of the muscles that control chewing and swallowing. To assess swallowing, observe a new resident or resident for at least 3 meals. Observe if there is fluid leaking from the nose after swallowing. Watch for packed food in the cheeks and drooling. Difficulty swallowing can also be detected by the presence of a weak cough or gag reflex, or by the inability to cough. Your challenge is to help them eat and drink in spite of poor memory, loss of smell, and the decreasing ability to swallow and feed themselves. Undernutrition and dehydration can lead to many problems, including a decrease in skin strength, making it more prone to tears, prolonged wound healing, constipation, and decreased resistance to infections. Loss of strength, endurance, and mobility places the resident at high risk for falls, weak bones, decreased functional status, and increased dependence on you for their physical and emotional needs. In addition, just one resident demonstrating signs of dehydration in your facility requires state surveyors to thoroughly assess that case and other aspects of care regarding fluid intake and nutrition. This can result in serious financial penalties and a ban on new admissions for your facility. As immediate caregivers, you know the most about your residents' needs and how they react to the world around them. You can help encourage them by using this familiarity to engage them in eating, by working with their pleasant memories, by using routines that they are familiar with and that they are likely to find enjoyable. Maybe Mrs. Morse likes to sit at a table near the window. Maybe Mr. Myers likes to begin his meal after carefully placing a napkin in his lap. Learn which memories work well for each of them, which foods they each like. And if you don't know, ask. If they can share, ask your residents. If they can't, ask their families and friends about what foods their loved ones enjoy. What were their favorites from childhood? How do they like to have food served? Some people like soup from a cup, for instance. Find out what sorts of pleasant memories from long ago that they have, like preparing a party for children or eating out with friends. Once you learn these things, you can carefully try to add them into the routine for each resident. When we observe and learn what works for each of our residents, we can use that knowledge to treat confused residents in a way that will limit behavioral problems like aggressiveness. Residents with dementia especially need to be kept safe and secure. Guidance and cues. Appropriate stimulation, but not too much. To limit changes. Sometimes any changes may be stressful for them. So as you are able, gently, slowly introduce your new knowledge of each resident into his or her daily routine. But do be careful. The most sensitive residents may have trouble with anything they find unfamiliar. Experts have found that developing, using, evaluating, and continually revising a structured daily program can reduce the stress and cost of providing care. Residents with dementia do better when all or most of their time is structured, spending it in activities directed by staff rather than being left to their own devices for much of the day. This approach also lets residents function to their fullest, enhances family satisfaction, and enriches the lives of all. Nursing assistants are crucial in developing and directing these programs because they know their residents the best. Let's look at some examples and see how to make snack and meals more enjoyable and to encourage eating. Associate snack and meal times with familiar events from earlier in the resident's life. This connects eating today with an understandable and familiar activity for the resident. Let residents know that a meal or snack is coming by giving them napkins to handle, or maybe having them set the table. Help them anticipate. Show and let them smell or even touch cooked food. Allow them to use different senses to connect familiar items to memories. This can help to make mealtime and eating understandable and familiar, and residents will be less likely to resist. Residents often spill food on themselves while eating. Some residents may be confused or embarrassed by a bib. Remember that they don't recall that they are ill? Instead, suggest to women that a kitchen apron is a good idea. And for men, try a barbecue apron. Again, find a substitute that is familiar and understandable to residents. Use other events during the day as eating occasions. Work with the activity director to have snacks served every day during activity time. Usually, drinks, snacks, and meals are delivered on a nourishment cart. This is an unfamiliar item to most residents, so it will possibly confuse or even frighten them. Turn this time into one that is pleasant for residents and staff. Since residents often eat dessert first at meal times, save the dessert to serve at snack time instead. Use a restaurant tray or a tea cart to present items. Just like in the movies, props can call to mind a familiar time or place or memory. Try a meal cart or snack tray. Ask residents for suggestions to make eating and mealtime more familiar and fun. If you can guide and direct, residents can enjoy serving the desserts and drinks to one another. Instead of something unusual and disorienting, this becomes a familiar, understandable social event, and it more pleasantly meets the need for food and drink. Make eating occasions familiar and routine with as little confusion as possible. Limit noises and distractions. If someone is overwhelmed, give them one food at a time. Be sure foods are not too hot or too cold. When possible, have more highly functioning residents sit with lower functioning residents. They can encourage other residents and model eating. Seeing and hearing others may help cue them to eat. Early intervention should include a consultation with a speech therapist. The staff needs to be prepared for intervening if choking occurs. Training in the use of the Heimlich maneuver, suction machine, and portable oxygen delivery is essential. When assisting with feeding, sit down and take your time. Proper positioning for swallowing involves instructing the resident to sit erect, leaning slightly forward with their head also flexed forward. Instruct residents to open their mouth and feel the food on their tongue. For residents who have had a stroke, food should be placed on the unaffected side of the tongue with a spoon. This should be followed by pressing gently and rocking the spoon back and forth. Once the food is in the mouth, instruct the resident to taste the food, chew, lift their tongue to the roof of their mouth, close their mouth, put their chin down, and swallow. Some residents might need a staff person's assistance to hold their lips closed and to swallow. To aid swallowing, massage the throat slightly on the affected side to help stimulate the swallow reflex. After swallowing, the resident should be instructed to swallow again to make sure that their throat is clear. If food seems to be packed in the cheeks, instruct the resident to use their finger to move it onto their tongue for swallowing, or you may use your gloved hand to assist in moving the food and give direction for swallowing. Keep in mind that fluids may be more difficult to swallow than solid food. These should be administered cautiously and according to the dietitian's and speech therapist's recommendations. After eating, keep the resident in a sitting position for at least 15 minutes. Talk about and prompt for eating, chewing, and swallowing. If forks or spoons are hard to use, offer residents appropriate finger foods. Make sure the food isn't too hot and cut food into small pieces. Maybe there are times when some residents are less confused or tired. Use that time to encourage them more. Breakfast may be the best meal for some, lunch or dinner for others. Poor teeth, lack of or poorly fitting dentures, mouth pain, and inflamed gums or tongue all impact negatively on nutritional status. You can also help residents overcome these challenges. Obtain a dental consultation as indicated. If oral hygiene is poor, encourage or provide mouth care before each meal. Make sure that dentures are used and fitting well. Solid bright red or blue plates may be better than pale or pattern plates to help residents find foods. And for some, a bowl may work better than a plate. Residents may also benefit from adaptive utensils, plates, and cups. Ask a dietitian to help pick foods, drinks, and snacks which are appealing and appropriate to the ability of each resident. And anytime you can, encourage eating and drinking. During feeding and any activity, Try to focus on residents as well as the task at hand. By closely observing each resident, you'll find valuable clues about each person that can simplify your work. For example, you notice that Mr. Myers reached for a napkin for his lap. Now you can cue him that it is mealtime by handing him a napkin or helping him place it in his lap. Finally, if you do see changes in behavior, tell the nurse. These changes can be important signs that residents might need special care or accommodations. We've shown how residents with dementia can benefit from steady and regular routines. Often a structured day or structured programming can also provide some familiarity and comfort. Structured programs often include 4-hour blocks of 30-minute activities. Let's look at 2 more possible uses of structured programming. Breakfast. Residents are prepared for breakfast and dine from 7:15 a.m. to 9 a.m. This is an acceptable group activity. The nursing assistant sits with residents, giving direction and cueing residents to eat and assisting those who need more assistance. Having residents sit together allows better functioning residents to give verbal directions to the other residents, and by modeling eating, cue other residents to eat as well. Other familiar things and activities from residents' previous lives are helpful as they end their meals. For example, women frequently will leave the table carrying a cup, dish, or silverware in order to begin washing dishes after the meal. This habitual behavior can be useful. Place dishpans of warm, soapy water where they can wash the dishes. The end result will be that the residents will rinse some food off of their hands, lessening the cleanup needed from nursing staff. In addition, they will be involved in their daily lives. Above all, remember that mealtime should be pleasant and enjoyable. That enjoyment is tied into a relaxing and comfortable atmosphere and foods that residents desire. If it is not too stimulating and is possible in your facility, offer residents choices or select foods that you know they like. Mealtime is also a social opportunity, a chance to be with friends and visiting family. Even if residents with dementia have trouble communicating, talk with them and understand that they will probably appreciate being around people they enjoy. No matter what the activity, keep residents involved in ways that work for them. Help them to find enjoyment in their own lives, to live fully in each moment. These moments may seem small, but can bring a sense of well-being to a life that is too often confusing. The more you can help residents find familiar ways to connect their memories and experiences to today, the more you can enrich their lives, make families happy, and decrease the stress and workload of caregivers. Nutrition and hydration is an opportunity to engage residents, to help them find joy and fulfillment. Understand their limitations and their capabilities. Involve them in eating and drinking. Encourage good nutrition and provide the best care for your residents.